The gentleman from California is recognized for 1 hour.
Thank you, Madam Speaker. Madam Speaker, for purposes of debate only, I yield the customary 30 minutes to the gentleman from Texas, pending which I yield myself such time as I may consume. During consideration of this resolution, all time yielded is for purposes of debate only. I ask unanimous consent that all members be given 5 legislative days to revise and extend their remarks.
Without objection.
Thank you, Madam Speaker. Madam Speaker, yesterday the Rules Committee met and reported a structured rule, House Resolution 713, providing for consideration of House Resolution 1309, the Workplace Violence Prevention for Healthcare and Social Service Workers Act. The rule provides 1 hour of debate equally divided and controlled by the chair and the ranking member on the Committee on Education and Labor, and makes in order all 10 amendments submitted and provides for a motion to recommit. It also provides standard recess instructions for next week's district work period. Madam Speaker, there is an epidemic of violence against healthcare and social workers in the United States. Last year, Department of Labor statistics showed they were nearly 5 times as likely to suffer a serious workplace violence injury than workers in other industries. The General Accounting Office found that rates of violence against healthcare workers in hospitals, nursing homes, and residential care facilities is 5 to 12 times higher than the estimated rates for workers overall. Between 2011 and 2016, 58 hospital workers died as a result of workplace violence. For me, this matter strikes close to home. In 2010, Napa State Hospital technician in California, Donna K. Gross, a constituent, was killed outside the state hospital by a patient under psychiatric care. Donna entered the profession to honor her mother, who battled mental illness and was a patient at that very hospital. She was the mother of 3 grown children and was raising her granddaughter. Her colleagues described her by saying, "First and foremost, Donna is a human service type person, a loved being with people and working with people, who loved working with people." Donna's life was cut short when a patient brutally murdered her to steal jewelry and cash from her. This story is just one of hundreds and thousands of incidents that are on the rise. Sadly, violence has become so commonplace for healthcare workers that they think it's part of their job, resulting in only 30% of violent incidents being reported. Some states have stepped up to enact laws to require employers to establish a plan to protect against workplace violence. Donna's story, for example, inspired action in California that I was proud to be a part of when I was chair of the Senate Labor Committee. That action in California served as the basis for the bill before us today here in the rules and tomorrow on the floor. These workers deserve national action, and they deserve it now. At the Occupational Safety and Health Administration, these workers are not receiving the urgent attention they need. OSHA takes at least 7 years to put out a standard, but in some instances can take up to 20 years. People like Donna K. Gross cannot wait that long. To protect the people who dedicate their lives to caring for us, we need to move now. The longer we wait, the more people will suffer. Madam Speaker, I thank you, and I reserve the balance of my time.
The gentleman reserves. The gentleman from Texas is recognized.
Madam Speaker, I thank the gentleman for yielding me the customary 30 minutes, and I yield myself such time as I may consume. Madam Speaker, today we are considering a bill that requires the Secretary of Labor to issue a rule on workplace violence prevention in the healthcare and social service sectors. According to the Occupational Safety and Health Administration, workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the work site. It may be surprising to hear that acts of violence are the 3rd leading cause of fatal occupational injuries. Of these incidences, approximately 8% were intentionally caused by another person. So when Americans go to work each and every day, they do not expect to face violence or other harm. And the risk is especially high for healthcare providers and for social workers. These caregivers can be subject to patients that may not be in control when under the influence of medications, or they may have a mental disorder, upset family members, ongoing domestic disputes, and even gang violence. The rate of workplace violence resulting in days away from work for healthcare providers is, on average, 4 times higher than other professions. In addition, healthcare providers and social workers are less likely to report incidents. This may partly be due to the pledge to do no harm and the inclination to forgive patient-caused injuries as accidental. Regardless of the situation, all workers deserve a safe workplace. The Occupational Safety and Health Administration is responsible for setting the standards to ensure the safety of American workers. Under the General Duty Clause of the Occupational Safety and Health Act of 1970, employers must provide employees with a safe work environment. Currently, there's no mandatory standard on workplace violence prevention. However, in calendar year 2015, OSHA published guidelines for preventing workplace violence for healthcare and social service workers, and is currently working on a workplace violence prevention rule. H.R. 1309 would require the Secretary of Labor to issue a rule on workplace violence prevention based on OSHA's 2015 guidelines. An interim standard is required within 1 year of the passage of this legislation, and a final rule must be issued within 2 years. While the goal of this legislation is laudable, it's important, the time frame imposed on the Department of Labor and OSHA does exceed the norm. Between 1981 and 2010, the time it took OSHA to develop and issue safety and health standards raised from 15 months to 19 years, but the average was more than 7 years. While no one believes we should continue to delay worker protections, OSHA has already begun the rulemaking process and is gathering stakeholder input. And according to OSHA, the OSHA rulemaking process, a rule should take 10 years to complete. There are 7 stages comprised of 48 different steps. For example, one step is listed as continued discussion with stakeholders. The penultimate stage requires OSHA to send the final rule to the Small Business Administration before submitting the rule to Congress. This last stage involves developing a small entity compliance guide responding to legal action. So this is bureaucracy at its finest. While it is important to ensure that any rulemaking does not adversely affect the people and industries it is meant to assist, the length of this process far exceeds other administrative rulemakings. Perhaps rather than pass a bill to require the issuance of a single rule, we should be considering reforms to the entire OSHA rulemaking process. Seems like that may be overdue. Despite the lengthy process of OSHA rulemaking, as written, this bill truncates established rulemaking procedures. But that's up to us. Until Congress changes this process, OSHA will follow the established framework to develop workplace violence prevention, its workplace violence prevention rule. H.R. 1309 requires covered employees, including hospitals, outpatient facilities, residential treatment facilities, which includes nursing homes, and any other medical treatment or social service clinic at correctional facilities to develop and implement a written workplace violence plan within 6 months of the issuance of a rule. The plan must include identification of violence risks and prevention practices and incorporate reporting and emergency response procedures. In addition, the plan must delineate violent incident investigation procedures and training programs for employees. Again, the importance of such a plan is undeniable. 6 months may be a short time frame within which to determine all of the required components. In order to produce the most effective plan to ensure employee safety, employers really should be granted adequate time to fully evaluate their workplace, gather input from employees, and identify the best procedures to ensure a safe environment. It is possible, given this short time frame, that workplace violence prevention plans could be hastily and therefore incorrectly assembled. So here's the good news. There is middle ground. While OSHA's rulemaking process is lengthy, this bill's timeline is short. OSHA is currently gathering feedback from stakeholders and requiring an expedited rulemaking that will limit their input. While OSHA rulemaking would ensure enforcement of workplace violence prevention policies, according to a 2018 American Hospital Association survey, 97% of respondents reported already having a workplace violence prevention policy in place. In 2009, the Centers for Disease Control and Prevention stated that additional research was required to identify effective strategies to prevent violence, particularly in healthcare settings. In addition, the Congressional Budget Office estimates the cost to private entities will be well over $2.5 billion the first 2 years of implementation and almost $1.5 billion annually thereafter. The rule self-executes a manager's amendment that will bring this cost down to $1.3 billion for the first 2 years and $700 million annually thereafter. But this mandate may make it difficult for rural hospitals and healthcare providers to continue effectively serving patients in their more rural locations. Extending the implementation timeline of this bill may help reduce some of these concerns. We had an opportunity to work on a bipartisan basis. This is not a partisan issue, to solve a problem that we all agree needs to be solved. We are instead considering a bill that circumvents the established rulemaking process in favor of a swift outcome. We can all agree that there is need for OSHA to issue proper workplace violence prevention regulations to protect healthcare providers and social workers. I hope we are able to accomplish this goal, but we should recognize that we are placing burdens on entities through an expedited process that may require modification in the future to ensure a safe and effective workplace for all Americans. For these and other reasons, I urge opposition to the rule, and I reserve the balance of my time.
The gentleman reserves. The gentleman from California is recognized.
Madam Speaker, I yield 2 minutes to the gentleman from Connecticut who has put so much work into this effort.
The gentleman from Connecticut is recognized for 2 minutes.
I stand corrected. 3 minutes.
The gentleman from Connecticut is recognized for 3 minutes.
Thank you, Madam Speaker, and I rise in support of the rule. And I would just sort of note for the record that Mr. Desaulnier and Chairman McGovern deserve great credit because this is basically an open rule. There was 8 amendments which were offered to the Rules Committee, and all 8 amendments were made in order, including a Republican amendment, which is somewhat in line with Dr. Burgess's comments from Mr. Byrne, from Alabama, who was on the committee. So, again, I would just say this shows that the Rules Committee was serious last January when they said we're going to have a new era of bringing down the number of closed rules as much as possible, and this is a perfect example of it. In fact, Politico this morning wrote a story saying that this is actually the first bill to come to the floor that was a completely open rule, that accepted every amendment which was offered by members. And I don't know if that's true, but certainly it's true that all amendments were made in order with the rule that's presented. So I guess, sometimes you sort of wonder, when do people take yes for an answer in this chamber? Again, Mr. Burns can have ample opportunity to make his arguments, and I look forward to opposing it on the floor as I did in committee. And again, to me, it seems like a rule that all members should really support. So again, just to begin with Mr. Desaulnier's description of the problem, and again, Dr. Burgess certainly did not quibble about the fact that this is a real problem, which we're talking about. In 2013, myself and former Congressman George Miller asked GAO to look at this problem. They took 3 years to study it. They used Bureau of Labor Statistics, Justice Department statistics. They, again, did surveys, and they found, in fact, that we have a really very scary problem in terms of the 15 million healthcare workers that go to work every single day, 5 times as likely to be the victims of intentional assaults than any other sector in the U.S. economy. And what's most alarming is the trajectory is going up, that this is not a problem which is sort of level, normal, operations. It's something that is actually getting worse. And there's no secret why it's getting worse. The heroin opioid epidemic, the behavioral health problems that exist out there in society make every ambulance call that EMTs are going out for an overdose, every emergency room patient that's coming through the door, every rehab patient that's going into a facility for treatment, all of these now are high-risk situations. And yes, there are some hospitals that have taken proactive steps. They've used the OSHA voluntary guidelines. They've looked at the Joint Commission on Hospitals that has endorsed those guidelines and has again, written strong advocacy in favor of having a national standard for this problem out there for many workers, and that's why we need to act. Again, just so we're clear, OSHA in 2017, as the Obama administration was leaving, put it on their regulatory agenda. They took too long, and I will be the first to stipulate. Can I just
Be happy to give another minute to the gentleman from Connecticut.
I would be happy to stipulate they took too long. Since the Trump administration has taken over in the 34 months, they have not held one hearing in terms of stakeholder input. Yes, they scheduled 2 small business reg review hearings, canceled both, and they have not rescheduled. So 34 months into this administration, there is nothing happening. And this bill fundamentally is about Congress, as it did with bloodborne pathogens, which again addressed a crisis in hospitals back in the 1990s and early 2000s, which a Republican Congress, by the way, supported, put a deadline on OSHA to get a rule in place. And we're a safer country because Congress took that action. And that's what this bill does. It is 42 months, by the way, in terms of the deadline for the rule, and it is 1 year for the interim rule. We accommodated Republican objections in the committee and made sure everybody gets a comment period on the interim rule. And we also carved out doctors' offices, dentists' offices, anybody that's not part of a healthcare facility. We shrunk the scope of this bill to healthcare facilities, 200,000, which is going to reduce the mandate
Time has
costs.
expired.
One more.
Could we give him one more moment? I'm told he's about to wrap up.
Okay, I'm about to wrap up. The cost per facility, which Dr. Burgess referred to, which was reduced because of the reducing of the scope of the bill, is $9,000 per facility per year. So, when we talk about the healthcare sector and how much money gets spent in it, how many patients come through the doors, and these are not, the small independent practice doctor's offices. These are healthcare facilities. The fact of the matter is it's $9,000 a year for 2 years, and it goes down to $3,000 a year in terms of cost and expense. And what's the benefit? Lower workers' comp costs, less absenteeism, and trying to improve the morale of the people who are doing the right thing every day in this country in terms of providing care for those who need to be healed, consoled, and cured. We need to pass this bill, and again, we made Mr. Burns' amendment in order, but we need to reject that amendment, which just throws it back to OSHA, whose batting average is really a disgrace in terms of getting rules through the process. And with that, I yield.
I do want to appreciate the passion and the amount of work that the gentleman has put into this product. And with that, I'll reserve the balance.
The gentleman reserves. The gentleman from Texas is recognized.
I'll yield myself 2 minutes. Just so that we're technically accurate, the resolution in front of us today, point number 1, it is a structured rule for H.R. 1309. This is not an open rule. I have served in the United States House of Representatives when we had open rules, and it is a different environment. Now, Mr. Cole, last night in the Rules Committee, did make a motion for an open rule on this, saying if you're going to accept all these amendments, maybe we just ought to open the floor up to all members and It's an important topic. Let's get their input. But the request for an open rule was voted down in the Rules Committee. It wasn't really a suspenseful vote. The Republican side lost 4-9, which is generally the way that works out in that committee. But I'm grateful that so many amendments were made in order. I think that is important, but I also feel obligated to point out under no circumstances should this be regarded as an open rule. It is anything but. I'll reserve my time.
The gentleman reserves. The gentleman from California is recognized.
Madam Speaker, I yield 2 minutes to the gentlewoman from Nevada.
The gentlewoman from Nevada has 2 minutes.
Thank you, Madam Speaker, and I thank the gentleman for yielding. Healthcare and social workers are some of the most dedicated, least appreciated workers in this country. They are the workers caring for the sick, the elderly, and the most vulnerable Americans while usually making just barely enough to get by. And a tough job is made even tougher by the fact that these workers who are treating people in stress, often in private settings, are 5 times as likely to be the victims of workplace violence. What does it say about our country that we can't protect those workers who have dedicated their lives to protecting our most vulnerable citizens? It's unfair, and the bottom line is this: no person should feel unsafe in their place of work. The Occupational Safety and Health Administration, or OSHA, has the authority to protect American caregivers and healthcare workers from workplace violence. But the reality is that there is no nationwide OSHA standard for how employers are supposed to protect their employees from workplace violence. And not just that, but in 24 states, nearly half the country, public sector health and social service workers are not covered by OSHA protections. We have the responsibility and we have the authority to protect America's workers, but we have not given our government or our businesses the tools they need to protect hard-working Americans from workplace violence. This bill, the underlying bill of this rule, will change that. The Workplace Violence and Protection Act, which will require OSHA to implement a standard for workplace protections for healthcare and social workers. It provides protections for public sector workers where none existed before, and it identifies risks, solutions, training, and importantly, protections from retaliation for those workers who report violence in the workplace. I strongly urge my colleagues on both sides of the aisle to support this underlying bill, and I uphold our duty to keep every American safe. I yield back the balance of my time.
The gentleman from California reserves. The gentleman from Texas is recognized.
Madam Speaker, I yield myself such time as I may consume. If we defeat the previous question, Republicans will amend the rule to immediately consider H.R. 1869, the Restoring Investment and Improvements Act. This bill, which has 271 bipartisan co-sponsors, would fix a technical error in the Tax Cuts and Jobs Act to allow qualified improvement property to depreciate over 15 years and be eligible for immediate expensive. Madam Speaker, I ask unanimous consent to insert the text of this amendment into the record, along with extraneous material, immediately prior to the vote on the previous question.
Without objection.
And Madam Speaker, I yield 5 minutes to my good friend, the Representative, Ms. Walorski from Indiana, to further explain the bill.
The gentlewoman from Indiana is recognized.
Thank you, Madam Speaker. I rise to vote down the previous question. If we defeat the previous question, Republicans will amend the rule to include the restoration of the 15-year schedule for qualified improvement property, or QIP, as part of H.R. 1309, the Workplace Violence Prevention for Healthcare and Social Service Workers Act. Madam Speaker, there is strong bipartisan support to fix QIP, which affects restaurants, retailers, and other leaseholders in every congressional district in this country. There are 271 bipartisan co-sponsors split nearly evenly between Republicans and Democrats on H.R. 1869, which I helped introduce to resolve this issue. Fixing QIP is a common sense solution that would unleash investment, create jobs, and help small businesses grow. However, it also requires urgency, and Congress must do everything in our power to address this issue as soon as possible. I hope that we defeat the previous question to ensure that restaurants, retailers, and other small businesses are able to unlock the full benefits of tax reform and continue driving our nation's economic growth forward. Failing that, I sincerely hope that all sides can come together before the end of the year to enact this bipartisan, common-sense piece of legislation. Madam Speaker, I urge my colleagues to vote against the previous question and yield back.
Yields. The gentleman reserves. The gentleman from California is recognized.
Thank you, Madam Speaker. Just a couple of points for my friend from Texas. He is correct on the open process. However, we did allow for all 10 amendments that was submitted to be accepted, and the final vote was 2-9, understanding that that was a foregone conclusion to many of us. And I'd just say this is such an important issue in the urgency, and I would like to join with my colleague to fix the standard and the practice, and to add funding so that the department can do it. There is an urgency for problems like this to be solved. We can save money in the long run. When I was in local government, I was on the governing board of our county hospital. We had 2 of our 5 floors were psych wards. We spent hours and hours in closed session dealing with liability issues on those wards. So when I read this bill, I think that so much of what's in this bill, many of us have already done, at least in California, at the local level and at the state level. And it's good business practice. As somebody who is a former small business owner that had high workers' compensation in the restaurant business, cost avoidance is a good thing. My workers' compensation carrier came out at least once a year to inspect our facilities and see where we could avoid these incidents. So it's just a good business practice. When I look at this, it makes so much sense. There is a cost to start this, but there's clearly, in my mind, a physical saving and an emotional saving when you think of the lives lost. And this is not new, but the demand and the changing trend lines say to me that this is urgent. So I would like to agree with my friend from Texas that, and I'd be happy to work with him, that incidents like this department really needs to be ramped up. It's a national embarrassment that it takes 20 years or 7 years for the department to do these rules, understanding that you have to work with stakeholders. So I think there's an element of opportunity here for us. I do think that it's unfortunate, as we talked about in the Rules Committee last night, and Mr. Byrne talked about, that we couldn't get across the finish line and come together completely as a bipartisan bill. Having said that, as my friend from Texas alluded to, this is a bipartisan bill. We do have supporters, including Mr. Cole. So with that, I would reserve. I have no other speakers, and I understand that you have no other speakers either, so I reserve the balance of my time.
The gentleman reserves. The gentleman from Texas is recognized.
Thank you, Madam Speaker, and I'll yield myself the balance of our time.
The gentleman is recognized for the balance of your time.
And I thank the gentleman from California for his comments, and I would agree that the efficient functioning of any federal agency should always be our highest priority, and the efficient use of the taxpayer funding that goes into those agencies or branches of agencies should require our constant attention, and we should always be looking to improve the service and the protection that those agencies provide. I will also predict that this bill is likely to pass with a large margin, and it will be bipartisan, and will raise the question of why we're not considering it under a suspension of the rules, but nevertheless, that's what the majority has chosen to use their time doing this week, so we have the bill in front of us today. Workplace violence is a threat that no American should have to face. The threat is particularly high for healthcare providers and for social service workers. These workers dedicate their lives to taking care of others, and they deserve to be taken care of in return. I support the goal of this legislation. I believe it would benefit from further discussion to ensure that the timeline for issuing a rule and developing a workplace violence prevention plan will produce the most effective and safe outcome for American workers. So I do urge a no vote on the previous question and a no vote on the rule, and I will yield back the balance of my time.
The gentleman yields. The gentleman from California is recognized.
Thank you, Madam Speaker, and I want to thank my colleague from Texas. Madam Speaker, Democratic and Republican administrations have sat idly by while healthcare and social service workers are being beaten, abused, and killed. The problem is not going away. It's getting worse. In the words of the ranking member of the Rules Committee, the distinguished gentleman from Oklahoma, he will be voting for the bill because it's better than what we've got. I certainly agree. This bill does far better for our frontline workers who we ask to care for us every day. I urge a yes vote on the rule and the previous question. I yield back the balance of my time, and I move the previous question on the resolution.
The question is on ordering the previous question on the resolution. Those in favor say aye. Those opposed, no. In the opinion of the chair, the ayes have it.
Wait a minute, I need to ask for a roll call vote. I want that.
Does the gentleman ask for the yeas and nays?
I ask for the yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Pursuant to Clause 8 of Rule 20, further proceedings on this question will be postponed.